I'm excited to introduce to you today our keynote speaker, Dr. Kelli Wells. Dr. Wells was named Director of the Florida Department of Health in Duval County in early 2013. Known for her passionate patient advocacy and compassion leadership, she is committed to advancing the agency towards meeting its mission to protect, promote, improve the health of all people in the state of Florida. She completed a family practice residency in St. Vincent Hospital in Jacksonville, Florida. As a National Health Service Corps scholar, she spent the first years of her medical career working in the health department clinics in Duval County. After a number of years in the private sector, Dr. Wells returned to the public health in 2009, first as clinical services Director of the Florida Department of Health in Escambia County, where she remained for 4 years. In May of 2013, the Jacksonville City Council and Mayor Alvin Brown approved Dr. Wells' appointment by the state surgeon general to the position of health director. As the director of the Florida Department of Health in Duval County, Dr. Wells has the opportunity to impact health outcome on a large scale. She oversaw the development of a new agency strategic plan and is working to strengthen collaborative relationships which meet the needs of residents in the Duval County and its surrounding areas. Dr. Wells is a leading agency reorganization focused upon the more efficient use of health resources. Since she became the health officer for Duval County, Dr. Wells has been elected to the Board of Directors for Florida Association of County Health Officials and leads the new Health Officer Mentoring Work Group. Dr. Wells is a member of the Board of Directors of Partnerships for Children Health and co-chair of the Public Health Committee of Duval County Medical Society and a member of the Board of Directors for the Northeast Florida Healthy Start Coalition. She is serving the Mayor's League as City's task force to improve access for uninsured children and the 100 Resilient Cities initiative. She also served on the City Council Task Force on Coalition Government. Dr. Wells is a graduate from Florida A&M University and the University of Florida College of Medicine. Please welcome Dr. Wells.
Good afternoon.
Hi.
Thanks so much for having me, though you all didn't have a say in it, did you? Yeah, I'm just here talking while you eat. But I'm pleased to have the opportunity. I come from an agency that has a very, very strong environmental health program and has really modeled collaboration with community partners in order to meet the needs of our community residents. So when they heard I was going to speak at the summit, they were like, so a lot of them came with me. I've got one of our environmental managers here, Grasnia Pavlovich. And in the back, I have our director of our environmental health division, Scott Turner. And then our assistant director of public health programs is Gail Tucker Disney, who was the director of environmental health for many years. And they've already made friends and reconnected with old colleagues, so it's been wonderful to be able to share with them what partnership they've had for a number of years. I'm new in this position, and it hurts, and it's getting better. I have a large task ahead of me as the leader of an agency that really essentially is a turnaround organization. When you have a turnaround organization and you have such an important charge, it becomes vitally important that we learn how to communicate effectively, how to collaborate well, and how to remain engaged with our partners. So it's been a challenging year and a half, but we, again, are happy to be surrounded by such strong team members, and I'm glad to have the opportunity to speak to you today about the environmental impact on public health. So, heard of Ebola?
Yeah.
Yes. This has presented quite a challenge for the Department of Health in that it has forced us to come together and really create a state of readiness to respond to this. It was quite a challenge, significant challenge, because we were dealing with public perceptions, we were dealing with misinformation, we were dealing with rumors and irrational fears in some cases. But we have chosen, and I have chosen, to look at it as really an opportunity to use this as a platform to talk about the other things that can really get you. You know, because of where we're located, because of the systems that are in place, the likelihood of us seeing an Ebola case here in our community is really quite slim. But this has provided a platform for us to really talk about the things that you can be exposed to and that you are at risk for. So, you know, we have really stepped up our flu messaging campaign, for instance. We've used this as a jumping off point to really generate some of our messaging around the measles in recent weeks. So, you know, I'm thankful for it, though the twice a day, round the clock, or 7 days a week conference calls that we had statewide starting in October really proved to be a challenge and quite taxing on our staff. And we are currently monitoring travelers that are coming from West Africa. We have never had a high-risk traveler, high-risk defined as contact with someone who had disease. We haven't had any of those, but we are required to monitor low-risk travelers, and we are doing that on a consistent basis. And how many of you knew that, you know, we had cargo ships that were coming in from West Africa into our ports? We're also doing assessments of those ships as they come in. So it's keeping us busy. Defining environment, you know, a healthy and community environment encompasses aspects of human health, disease, and injury, and they're determined or influenced by factors in the overall environment. Examining the interaction between health and the environment requires studying not only how health is affected by the direct pathological impacts of things, but it's also important to look at factors in the broad physical sense of the environment, so in the social environment. So including housing, including urban development, land use, transportation, industry, agriculture. The World Health Organization really has demonstrated that there is a burden of disease that is directly associated with your environmental risk, and that children are inordinately affected. So certainly, for instance, with lead, we find that there is a burden of disease that children bear inordinately based on location and exposure risk that requires intervention, education, and remediation in many, many, many cases. Some areas of concern for public health really are related to certain areas of environmental areas, including unsafe water, poor sanitation and hygiene, vector-borne illnesses, and indoor air pollution. You know, and in many cases, the etiologies are intertwined. So we know that 1.1 billion people in the world don't have access to safe water. Poor sanitation can lead to vector-borne illness. We know that tobacco use is the leading cause still of death in adults, and that 60% of children under the age of 11 are exposed to secondhand tobacco smoke in their home environments. Air pollution is mostly derived from vehicular combustion and power generation, and we'll see later how that has a direct impact on health depending on where you live. The primary impacts also climate change. We have to think about heat stress, worsening of our air quality, and changes that will result in vector-borne illnesses. So environment absolutely can be a predictor of health. You know, and we look at it from a global standpoint. We talked about some things that are going on around the world, but it can relate to where you work, live, and go to school. It determines what you're exposed to. What your parents do, for instance, determines the exposure that children experience. Your socioeconomic status has a direct bearing upon what you're exposed to, because that determines the level of quality of life you're able to attain economically. It can determine your personal safety. You know, I tell people all the time, death by bullet is a public health problem, and it happens at an inordinate level in our health zone 1, in our urban core. And it's something we've got to begin to talk about. It's a real significant problem that has implications far-reaching. We have to begin to look fully at access to healthy foods. You know, as a family physician, it's all about prevention. So, you know, we get you in, we test you, we screen you, right? We tell you what you're at risk for, go home and do this, stop eating that, minimize that, decrease that. But if you don't have access to the resources, the tools to do the things that I've said, I really haven't helped you. And we have stopped carving health out of the conversation and really begun to incorporate it, because it really has to be a complete conversation. You can't talk about changing your diet and eating healthy if we don't talk about food access. And I'll show you a graphic later that really demonstrates that there's some areas in our community that remain food deserts. The environmental health framework, it can include multiple levels, from the subcellular level to the global level. It's not hierarchical in the sense that one level is more important than another, but rather in the sense that individual biology is progressively nested within the person, the family, the community, the society, and the ecosystem. The interactions and feedback loops within, across, and among these levels are complex and they're variable. They exert their influences on health across time. So preventing disease and promoting health requires actions and commitments from the individual, but also from the family, also from the community, also from the society, because they are all interconnected. So in this case, this is actually the foundation for a presentation that I've done several times, just called Place Matters. And this demonstrates a change in life expectancy for infants in Duval County based on where they live. So Health Zone 1 is there in the center in red, and that's also known as the urban core. And if you look at the legend there, you see that in Health Zone 1, the average life expectancy is almost 10 years less than those in Health Zone 3. I always point out at this point that that's where I live, Health Zone 3. Hello, we're okay. About 10 years more in Health Zone 3 in Mandarin in the south side. And so that is an objective example, demonstration of the fact that place really does matter. If you break that down further by race, and here looking just at blacks and whites, again, we'll look at Health Zone 1 and Health Zone 3. So Health Zone 1 is there at the top, that's the urban core. So for a white male in Health Zone 1, the average life expectancy is 71 years, 71.6, and for a black male, 70.8. What I'd like to draw your attention to is the disparity that exists across the health zone, blacks versus whites. So look at my healthy health zone in Health Zone 3, and you see that there is a disparity between blacks and whites there. It bears further discussion. We understand with health disparities that certain minority groups bear an inordinate burden of disease. So we tend to have a higher burden of disease. For instance, the African American community with diabetes are more likely to suffer preventable complications of those diseases, that sort of thing. And that may explain some of this. But I think the graphic evidence is really tremendous. You don't want to be a black male living in Health Zone 1, based on what the data is telling us. What we're exposed to in our environments, they actually influence health across the lifespan. So there are some things that we know that occur that influence your health before you're even born. So there's some fetal issues that can occur with exposures, right? It can actually, and that can traverse the entire lifespan, and it can either make you healthy and resilient, your environment, or these determinants of health can actually make you less resilient and more likely to suffer a burden of disease. So important determinants of health come from the natural built, chemical, food, economic, and social environments. And these environments are further defined through such things as education and housing and nutrition, access to care, your social supports, things like that. And many of those things interact to actually create or worsen disease. So here's an example. Billy, who has asthma. In general, asthma is multifactorial in its origin. And in some individuals, it can be triggered just by one exposure or one particular trigger. Examples could be chemicals in the air, chlorine, those sorts of things, air pollution. After it develops, symptoms can be exacerbated by exposures. So if we talk about where you live, and we talk about where, if that's determined by socioeconomic status, for instance, and that in turn causes increased exposure to air pollution, you can see how that might have a direct impact on health. So, triggers of asthma. I'm not sure what's happening. I'm not moving my finger. I have powers that you just aren't even aware of. Potential asthma triggers. So in someone like Billy, who already has asthma, an asthma attack can be triggered or set off by a wide range of many environmental factors. So exposure to indoor air pollutants, number one of those being tobacco smoke. Okay, outdoor air pollution, environmental chemicals, so pesticides, what's happening on the roadways around your particular environment. Allergens like mold, pollen, cockroach droppings, okay, pet dander. Think about it. If you don't have control over where you live, we literally have issues with parents of children whose landlords won't remediate the environment that they live in, right? And so we're fussing at mom because the asthma is out of control, right? They're missing school, but she can't exert the authority over her home environment that you and I might be able to do. Those are real issues, and that's why these things are so interconnected. Try to be really careful here. Yeah, I'm not doing well. I need special help.
You just switch to the clicker instead of that, just with the mouse like that.
Just a mouse that's there.
There'll be air up here.
I'm resilient. I'm independent, like you have to say it. Oh, it was on the, okay. Okay. I think this one. Okay. Perfect. Okay. All right, so let me make sure I'm good here. So indoor, industrial and air traffic pollution, let's go back to Billy. So Billy lives in a low-income neighborhood in Health Zone 1. Mom knows she lives in Health Zone 1, but she doesn't really know what that means, okay? He lives near a major roadway. He rides public transportation to get to a public school, okay? And children who are in relatively low-income families tend to be exposed to more traffic pollution, okay? And they're at greater risk than children in the same neighborhood who are better off financially. So 2 kids, Health Zone 1 is a great example where we have a kind of a disparity across the health zone as far as income is concerned. A kid who's better off financially in that area is actually a little less at risk than a child who lives in the same area but has less financial resources. What happens in the lungs with asthma? It's twofold. We don't often talk about that. What people think about is the wheezing sound, which is caused when the muscles constrict around the airway. So it makes kind of a whistling noise. But the second component to that is an inflammatory component, where you get a lot of mucus production, okay? And that actually can cause some scarring in the lungs, so a decline in lung function over time. So the goal for a physician like me is to prevent exacerbations of asthma so that we can preserve lung function. When I first started training years ago, we were not really focused on prevention because we were maintaining lung function. It was to improve quality of life and keep you in school or at work or that sort of thing. But what we found now is that adults with asthma now need to have pulmonary function testing at least annually to be sure that they're not getting a decline in function. That's a really important change to the way we've practiced medicine regarding asthma for years. There are no great studies about, the impact of family stressors and community stressors on health, but I think, we can certainly make a good case for the fact that because we know that there are chemical responses to stress, right? Your body produces certain things, including free radicals, in response to stress. And free radicals are instrumental in creating cancers in your body. You produce stress hormones, which can cause blood pressure elevation, right? If you define stress as poverty or ongoing financial stressors, exposure to violence, we had a baby get shot on the way to the bus stop one morning a few months ago. That's stressful, right? That could even occur is stressful. If we're talking about, and we've demonstrated that there is higher burden of illness in certain areas of the community or certain pockets of the community, the burden of illness and death from preventable complications is a stressor. And then, dysfunction in the family. All of those things can actually create and magnify some of the health problems that we're talking about here. So I think that's important that we keep that in mind. And again, I'm guilty of saying it. You need to reduce your stress. I'm wearing a white coat. You know, I'm spending 15 minutes with you telling how you need to reduce your stress so that your health can be better. But unless I understand what your real circumstance is, again, I haven't helped you. So we're really moving out of a model where, you know, again, the medical community and the medical visit is carved out and separate from all the other things that have to happen. And we're looking to collaborate with organizations across the community in order to be sure that when we say that, if I write a prescription and say it's for fresh fruits and vegetables, that we then can connect you to a resource that can help you to obtain that for yourself and for your family, which is a very important paradigm shift for us in medicine. You know, that I think as we become more focused on outcomes, it's where all physicians are going to be driven. So, percent of population living below poverty. Again, look at Health Zone 1. You see the range though. You know, you see 22% in zip code 32202 in Health Zone 1, up to 44%, almost half of people living in 32209, also in Health Zone 1, are living below the poverty level. That's just incredibly significant. Racial and socioeconomic disparities as it relates to burden of disease. So this is looking at asthma. So the disparities are dramatic. 1 in 9 of non-Hispanic Black persons of all ages, and 1 in 6 of non-Hispanic Black children had asthma in 2009. The greatest rise in asthma rates was among Black children from 2001 to 2009. Racial disparities are noted with increased risk for Blacks compared to whites, even after controlling for factors such as economic status. The disparities hold true across economic strata in urban as well as rural communities. So something is going on. We are forced, again, because of what the data tells us, to begin to look at things differently. You know, is it exposure? You know, I was listening to the end of the previous presentation, and there's some things that you know might well be environmental. You know, the cultural practice in some communities of staying, being there, even if you know there may be a perception of risk because this is my community. You know, that's a reality that we really need to try to address with folks and be certain that we are in fact remediating things appropriately and being certain that people are not at risk simply traveling to and from their homes. So obesity and asthma, there's an important correlation that we should be aware of, and there are a lot of initiatives now that are moving toward helping moms or women of childbearing age reach ideal body weight or maintain ideal body weight, because we recognize now that prior to conception, if you are obese, your risk of complications during your pregnancy is significantly higher, but also now there's a correlation with asthma and obesity in pregnancy. So, you know, there's a lot of talk about that, and here at the department we have the Healthiest Weight initiative, really encouraging Floridians to get to a healthy weight as opposed to the focus on not being obese. Let's talk about what the healthy weight is for you and let's try to get there. There are a number of initiatives particularly focused on women of childbearing age because of the sort of the cascade effects that exist when we have a mom who's obese who then has a child with some sort of complication, right? And then she's got additional risk of disease that can actually be a significant financial burden, not just on the family, but on the community as a whole. There's some significant data around, you know, the billions of dollars that could be prevented in costs associated with increased health risk, just related to obesity, arthritis, diabetes, heart disease. You know, direct correlations that if we got people to move more, if we made sure they had access to healthy foods, if they were safe walking around in their environments, we could really make an impact there. So, and that brings me to obesity in the built environment. One of the things that was mentioned in my introduction was my work on the Consolidated Task Force in this city. And the reason that I chose to be a part of that is, you know, it was the city council pulled together a group of quasi-experts in the community to come together. Quasi was only related to me, because I didn't know what was going on. I'd been here 5 minutes. But the idea was, let's look at consolidated government and see if it did what we wanted it to do for Jacksonville. That was the premise. So they looked at a number of things. They looked at administrative things and the way they assess costs for a lot of the city functions and those sorts of things. But what was important to me was the fact that health had essentially been written out of a lot of the conversations that our legislators and our lawmakers in our city were having. And in years past, the health officer actually had a seat on a number of committees at city council because there was a recognition of that alignment that needed to occur, and that had fallen by the wayside. So one of the things that came out of that task force was a recommendation to reinstate the position of health officer as a member of the Public Health and Safety Committee at city council. And so that was a concept that actually passed a couple of weeks ago. And the point that being is when we're talking about land use and zoning, when we're talking about neighborhoods, we need to remember that health should be a part of that conversation. And if you don't have health at the table, then the likelihood is we'll make decisions based on funding, loudest voice, advocate, lobbyist, and not necessarily based on what the needs are that we know to be true for the residents who don't necessarily have a voice in those conversations. So I'm pleased about that, and I'm proud of being able to advance that initiative because I know that the impact it'll make. So this is a graphic which talks about food deserts, and the pale area is our food deserts in our community. The blue lines are JTA lines. Now we had a conversation, our Childhood Obesity Prevention Coalition met a few weeks ago, and there was a representative from the planning division at JTA who was there talking about the improvements that they've made. Their new routes and how they're looking at walkability and rideability and safe routes for bicyclists. I can't even think of the word because I don't ride a bike. And he was dumbfounded when we suggested that there still existed food deserts even in light of their new routes. So we have promised to return to him with some data to help demonstrate that for him. There's some particular areas of concern. Really, if you look here, remember this is Health Zone 1. If you remember the picture, it's Health Zone 1. It goes 2, 3, 4, and 5 are the health zones, okay? So if you look at the areas where there are no bus lines associated, how are those folks getting to the grocery store, right? And how is that happening? And I toured that area a few months ago just to try to see what it was like. And as I was riding around, I recalled something. My husband is born and raised here, and I can remember visiting here before we moved here permanently and spending time with we spent time with his grandmother. And not knowing where I was in Jacksonville at the time, I realized my husband's grandmother lived on the east side. She had a little condo, right in the center of Health Zone 1. And I remember him sharing with me that as a young man, he would ride with grandmother on the bus to the grocery store and then help her with the bags from the bus. Grandmother was this tall. Okay, so when grandson isn't available, how does that happen? Really, how does that happen? You know what? You go to the corner store, you buy what's there, right? You buy what you can get. And so we have to stop talking about the proximity of things as if everyone has the ability to hop in a car and sort of travel there. We have to make things accessible for people kind of right where they are. So we worked on things like certifying local grocers and Walgreens stores for WIC, for instance. You become a WIC provider, so then if you qualify for WIC, then you can go there and get fresh fruits and vegetables. That means you get inspected by us, you demonstrate that you can do it, you maintain things at the right temperature so they can get their milk and their peanut butter and all of those things, not from the Winn-Dixie that you have to take a couple buses to get to, right? Those are the kind of initiatives that we need to be thinking about. So JTA has redone their lines. What do? Is there a way to do some sort of commuter transport? Is there a way to do a mobile sort of farmer's market? That's what needs to happen. And we've got to continue to have those conversations because most of us are going to home environments where that access is not a challenge. It's not an issue. So it's really quite important that we continue that conversation because it really is difficult for folks to make really good, healthy choices if if it's inclement weather. I mean, I won't go to the corner, right? How do you feed a family? So those are real issues that we're talking about. So climate change is, we've been talking about it a lot, and folks in Billy, our asthma child's generation, have heard a lot about climate change. And it's expected to increase ground level ozone, right? It's going to increase that through temperature and changes in wind patterns. Carbon dioxide levels are going to increase. That means that pollen levels will increase. Anecdotally, folks with allergies, right? It's been bananas. Isn't it bananas? It's going to get worse, right? There'll be changes in asthma-related pollutants in the air as a result of that. Now, if you overlay that, so if you overlay this on what we've already demonstrated are a number of vulnerable populations in our community, you see the impact, you can predict the impact. And so our opportunity really is now to advocate for those folks who are going to be inordinately impacted. Prior to me coming to this community, it did it again. You want me to be finished? Okay. The MAPP process was conducted, which really allowed community partners to come together to develop a plan for the community. The CHIP is a community health improvement plan, and it's important that it happen collaboratively because all of us have to work together to affect change. So it's not a Department of Health owned or run thing. We convene a conversation, but the idea is let's all get around the table, figure out what's important to our community, and then how do we measure it, and then how do we move the needle. So that process occurred in 2012. And the Partnership for Health-Duval actually was the organization that was formed as facilitators of that conversation. The plan now has got to be to continue to move the needle forward. So that the priorities that came out of the MAPP process and the things that are present in our community improvement plan, community health improvement plan, have to do with increased access to health services. Okay, we demonstrated in our surveys and our data collection that there were many people who didn't have access to a primary doctor. We still have folks in the urban core who are using the emergency room at UF Health as their primary physician, which, not only is UF Health really unhappy about it, right? They're really unhappy about that, but it's not the best place to go and get care, right? That 5.5 minutes that your private physician is able to spend with you, counseling you, teaching you, educating you about your disease process, about prevention, about what these blood levels mean, that doesn't happen in the emergency room. And there really isn't any continuity of care. It's not the place you want to go for care. And so we really have to undo the mindset that a lot of our folks in our community have about seeking services there. So access to health services is important. And then I would say that access to a health provider who's knowledgeable about your environment, about the things that impact your health outcomes, and can put the information in your hands is really key. So it's not just seeing a doctor, right? It's also got to be the right doctor. I used to tell people, when I was working in Escambia County, I would say, listen, if your physician won't listen to you, won't answer your questions, if you leave there and you don't understand, then you have the wrong doctor, and you need to take your healthcare resources and go elsewhere. Those who are disadvantaged, who don't have insurance, who don't have a health insurance card to go and shop somewhere else, what do? They space out their visits, they don't return, and they end up in the ER when they can't handle it anymore. And the cycle begins. So the impetus really is on us to be sure that the care they're seeking is quality care, but it's provided in a manner that really recognizes the specific issues that certain vulnerable members of the population face. One of the other big issues was increased access to mental health services. Now there's a lot of dialogue in our community about that now. There's actually tremendous focus as well on the care of our children in mental health. And so the Duval County Public School System has really invested a lot of time, energy, money into revamping their process. Because a lot of those kids who are in need of behavioral health services, they're ending up arrested on campus, right? In my first meeting with Dr. Vitti after being appointed to this position, he said, I want my teachers, my guidance counselors, my school staff to have some mental health first aid knowledge, to recognize the kid who's at risk or who needs intervention or care when they first miss, class, or when they first don't turn in the paper, right? Rather than when they act out, right? And so that there's a lot of focus there, and I think we will begin to see the needle move. But again, it required significant collaboration. There are lots of resources in our community that we're talking to each other. We don't really know where to refer folks, right? We're a little bit afraid of mental health diagnoses as a community, as a society. We don't talk about it really well, right? And so what you don't talk about, you can't really address. So that's beginning to change. And from an adult standpoint, we do offer behavioral health services at our clinics in the Department of Health. And we offer some specific services to patients who are living with HIV, for instance, to improve medication compliance. You know, that is actually a disease surveillance and epidemiology intervention, but there's certainly a need there. But we don't have enough providers. You know, we're spinning our wheels in some cases. So until we can raise awareness and then shift funding where we know the issues are, we'll continue to be talking about this as an action item on our community health improvement plan. We also wanted to improve chronic care management. So chronic care, remember I said there's disparities exist. Members of the community suffer an inordinate burden. They're more likely to die from preventable complication. So if you invest in chronic disease care, you can improve outcomes, right? And so there are a number of programs that are out there that are doing that. We house one at the Department of Health in our nutrition and chronic disease program called Diabetes a New Deal. How many of you heard my commercial? Really? My kids are the only ones who hear me on the radio. So the New Deal program is about diabetes self-management. You know, it's an evidence-based program where we talk to you, teach you. We develop train-the-trainer sort of programs. We go to the churches and community centers and that sort of thing to kind of empower people to manage their own disease. And then the fourth priority was to enhance communication with the local public health system. I've never seen a group of organizations that operate in such silo until I came here. Now we're all doing it now. We're all doing it. We're managing our budgets. We're training our people. We're getting it done. But we have not really done an excellent job on the public health side of things of really communicating with each other, right? And I'm horrified to tell you that some of that is turf. Like that horrifies me because that's craziness. Because the reality is, when you know what the problem is, then you come together to fix it. You have your resources. You have mine. We put it all in the pot. We study it. We determine, and we don't do it willy-nilly, right? It needs to be evidence-based. It needs to be structured, right? It needs to be tested, tried and true, right? So I'm not saying that at all. But if you're worried about whether your name is going to be on it, then it dilutes our efficacy substantially. And often, and I'm going to be perfectly honest, we don't move the needle as far as we could because we were worried about, assigning rights and responsibilities and credit. And so, I hope to be a leader that doesn't do that. We're trying to tear down walls and really sort of talk, what part can you do? What are you mandated to do by statute? Where does your authority end? That sort of thing. And so I've had that conversation multiple times with multiple partners. The school district is a great example. I have some statutory authority there, right? If there were an emergency or, a declared public health emergency, I can make you go sit down. I can put you in hospital jail. I got a badge and everything. It's really cool. Right, but all of the education, all of the teaching, all of the talking to parents, all of the creating the structure in the school, all of the access provided to the school health nurses that work for me has to be provided by the public school system. Right, so if we don't collaborate, if we're worried about turf or who's in charge, then that really sort of stymies our ability to make progress in that area. So that's an important thing. Like you can make lists all you want, but unless you're ready to come together to really talk about what the nuts and bolts work is, what's the real issue? Is there a policy change that needs to be associated with that? Okay, who do we talk to about that? Oh, Dr. Wells, you can't lobby. What do you do? Right, there's lots of rules, but we have to have the real conversations in order to be able to affect change. I'm doing so good with this little clicker now, y'all aren't even celebrating me. So the plans for the future are really to get ready for the next community health assessment, which will be due in 2016. We're tracking our environmental health indicators. So a lot of the things, the disease burden, preventable hospitalizations, those kinds of things we look at on a monthly basis. And we track our interventions associated with it. We need to continue to build relationships. Okay, we all have one priority. We're going to promote, protect, and improve the health of the folks in our community. That's our job, all of us. We're going to look at how well the community has done what it said it was going to do. Okay, and then when we see that there's a need to change, then we're going to try to change. We have to be responsive and resilient in order to be sure that because we're, in some cases we're hitting a moving target. it's necessary to stop, regroup, assess, and go, you know what, that's not working, let's try another intervention. And we can't be fearful about doing that. So I tell you, I'm not afraid. It's hard, it's challenging, but for kids like Billy that I spent, the better part of my medical career taking care of, it's worth it. There are some things that we as members of the community deserve to have in terms of health and safety in our environment, and it should in fact promote health. And that, my dad, people always say this to groups of lawyers and law students, my dad fancied me a lawyer, and really through my first year of med school, he was still saving law school money. And so at the end of year one, he kind of said, so I still got this law school money, how's that working out? Oh no, I'm staying, I'm going to be a doctor, Daddy. But the idea is really that we have to be able to have the crucial conversations and recognize that it's not just about us. Like, our job is to advocate for the folks who don't get to be here, who don't have a voice. And our social responsibility really is that when I have the opportunity to sit on the committee, that I'm not pushing my agenda, that I am the voice of Billy's mom, right? Billy's mom is living crisis to crisis, right? Her life may be somewhat chaotic because of social stressors, right? She can't come to the meeting. There are a number of interventions in this city where, after school programs and parent academy and that sort of thing, attendance is always very low. It is hard to break out of your crisis to come and get information. That's just the reality of it. So those of us who have the opportunity to engage in dialogues like this, those of us who have opportunities to sit on committees and influence policy, have a responsibility to Billy's mom to be certain that we are helping move the needle, not just temporarily, not just with the after-school program on the corner, but with the policies that influence her circumstance. That's all I have. Thank you.
Awesome.